Wanna pass the NCLEX? Then join us every Wednesday for NCLEX Wednesday. Let's see how many you can get correct in 5 minutes. A client diagnosed with heart failure is prescribed furosemide. Which of the following instructions should the nurse provide to the client regarding this medication? Select all that apply. Take the medication with a potassium supplement, monitor blood pressure regularly, rise slowly from a sitting or lying position, restrict sodium intake, or increase fluid intake. The correct answers are B, C, D, and E. Options B, C, D, and E are appropriate for a client taking furosemide. Monitoring blood pressure is essential because furosemide is a diuretic that can affect fluid balance and blood pressure. Rising slowly helps prevent orthostatic hypotension. Restricting sodium intake complements the diuretic effect, and increasing fluid intake helps prevent dehydration. A nurse is caring for a client with diabetes mellitus who is admitted with hyperglycemia. Which interventions are appropriate for managing hyperglycemia? Select all that apply. Administer regular insulin as ordered. Encourage a high diet in carbohydrates. Monitor blood glucose levels regularly. Encourage increased physical activity. Or administer a beta blocker to lower blood glucose. The correct answers are A, C, and D. Administering insulin, monitoring blood glucose levels, and encouraging increased physical activity are appropriate interventions for managing hyperglycemia in a client with diabetes. A diet high in carbohydrates and beta blockers are not recommended for managing hyperglycemia. A post-operative client has a prescription for deep vein thrombosis prophylaxis. Which intervention should a nurse implement for DVT prevention? Select all that apply. Apply compression stockings, administer low molecular weight heparin, encourage bed rest, assist with early ambulation, or administer oral anticoagulants. The correct answers are A, B, and D. Applying compression stockings, administering low molecular weight heparin, and assisting with early ambulation are appropriate interventions for DVT prevention. Encouraging bed rest and administering oral anticoagulants may not be suitable for preventing DVT. A client is receiving chemotherapy for cancer. Which side effects of chemotherapy should the nurse monitor for? Select all that apply. Nausea and vomiting, alopecia, increased appetite, diarrhea, bone marrow suppression. The correct answers are A, B, D, and E. Nausea and vomiting, alopecia, diarrhea, and bone marrow suppression are common side effects of chemotherapy. Increased appetite is not typically associated with chemotherapy. A client with heart failure is prescribed digoxin. What nursing actions are important when administering digoxin? Select all that apply. Monitor serum potassium levels, administer the medication with food, check the apical pulse for 1 full minute, hold the medication if the apical pulse is below 60 beats per minute, or encourage a high potassium diet. The correct answers are A, C, and E. Monitoring serum potassium levels, checking the apical pulse for 1 full minute, and holding the medication if the apical pulse is below 60 beats per minute are important nursing actions when administering digoxin. Administering the medication with food and encouraging a high potassium diet are not specific to digoxin administration. A client is admitted with a suspected myocardial infarction. What intervention should the nurse implement during the acute phase of an MI? Select all that apply. Administer thrombolytic therapy, encourage bed rest, monitor cardiac enzymes, administer aspirin as ordered, assess for signs of heart failure. The correct answers are A, C, D, and E. Administering thrombolytic therapy, monitoring cardiac enzymes, administering aspirin, and assessing for signs of heart failure are appropriate interventions during the acute phase of a MI. Bed rest is generally not encouraged in the absence of complications. A client with COPD is prescribed oxygen therapy. What nursing interventions are appropriate for managing oxygen therapy? Select all that apply. Monitor oxygen saturation levels, adjust the oxygen flow rate as needed, administer oxygen via a non rebreather mask, encourage smoking during oxygen therapy, assess for signs of oxygen toxicity. The correct answers are A, B, C, and E. Monitoring oxygen saturation levels, adjusting the oxygen flow rate, administering oxygen via a non rebreather mask, and assessing for signs of oxygen toxicity are appropriate interventions for managing oxygen therapy. Encouraging smoking during oxygen therapy is contraindicated. A client is receiving a blood transfusion. What nursing interventions are essential during blood transfusions administration? Select all that apply. Use a blood warmer to warm the blood. Administer the blood slowly over 4 hours. Obtain vital signs before starting the transfusion. Stay with the client during the first 15 minutes of the transfusion. Administer diuretics concurrently. The correct answers are C and D. Obtaining vital signs before starting the transfusion and staying with the client during the first 15 minutes are essential nursing interventions during blood transfusion administration. Using a blood warmer, administering blood slowly over 4 hours, and administering diuretics concurrently are not standard practices during blood transfusion. A client is admitted with cirrhosis of the liver. What nursing interventions are appropriate for managing complications of cirrhosis? Select all that apply. Monitor for signs of hepatic encephalopathy, encourage a high protein diet, administer diuretics as ordered, monitor for signs of bleeding, and restrict fluid intake. The correct answers are A, C, and D. Monitoring for signs of hepatic encephalopathy, administering diuretics as ordered, and monitored for signs of bleeding are appropriate interventions for managing complications of cirrhosis. Encouraging a high protein diet and restricting fluid intake may not be suitable for clients with cirrhosis. A client is scheduled for surgery and is NPO after midnight. What nursing interventions should be implemented related to the NPO status? Select all that apply. Administer oral medications with a sip of water. Monitor for signs of dehydration. Allow the client to chew gum to reduce oral discomfort. Place a sign on the client's door indicating NPO status. Offer ice chips for the client to suck on. The correct answers are B and D. Monitoring for signs of dehydration and placing a sign on the client's door indicating NPO status are appropriate interventions related to the NPO status before surgery. Administering oral medications, allowing the client to chew gum, and offering ice chips are not consistent with NPO status. Click subscribe and join us every Wednesday for new videos for NCLEX Wednesday.